I'm Dr. Ramona Lim. I work in the Lynch Syndrome Center as a gastroenterologist at Dana-Farber Cancer Institute and Brigham and Women's Hospital. Upper endoscopies can screen for early detection of stomach and duodenal cancers, which can be pretty common in Lynch syndrome. But we also can diagnose polyps that can be removed, and polyps can be precancerous polyps, just like the types that we remove in the colon. And it's important to remove those during the upper endoscopy as well. A common thing that we test for with Lynch syndrome at baseline upper endoscopies is to check and see if you have an H. pylori infection. It's a bacterial infection that can cause chronic gastritis but doesn't cause any symptoms necessarily unless it's associated with peptic ulcer disease and sometimes with cancer. And that's the reason we test for it, is we want to know if there's a modifiable risk for cancer that we can treat and eradicate with a course of antibiotics. An upper endoscopy is an evaluation of the upper digestive system. So like colonoscopy, we are placing a thin flexible tube with a light and a lens instead through your mouth that evaluates then the esophagus, the stomach, and the duodenum, or the very first part of the small intestine. We're able to visualize the lining of the upper GI tract on a video screen that displays on a TV monitor, and we're able to see if there are any abnormalities that need to be biopsied. Small instruments can be placed through the endoscope for us to then be able to obtain tissue samples that can actually go to the pathology lab for analysis. An upper endoscopy, unlike colonoscopy, does not require any special preparation. You simply have to not consume any food or liquid from midnight the night before your examination. And some medications that are critical for you to take might be safely taken the morning of the examination, but we recommend discussing that with your provider, with which medication should be stopped or held before the exam and which medication should be continued. During the upper endoscopy, you will have sedative analgesics in the vein or IV sedation. We often call it twilight sedation, but there is another option, deep sedation, with monitored anesthesia. These medications will allow you to be comfortable, not anxious, and drowsy during the upper endoscopy examination. Lynch syndrome patients are recommended to undergo upper endoscopies every 3 to 5 years. We typically can combine them with the annual colonoscopy on the years that they're being completed, but occasionally there may be more frequent evaluations if there's any findings on the upper endoscopy that require closer surveillance or if there is a concerning family history.